Doctors is joined by leading diabetes consultant, Dr. Siva. Good afternoon.
Good afternoon, Caroline. Thank you very much for the opportunity.
No problem. Could you tell us more about yourself?
My name is Dr. Siva Sivappriyan. I'm one of the consultant diabetologists working in Maidstone Hospital. And I have been a diabetologist for the last 8 years now, looking after many different aspects of diabetes, including young adult with diabetes, complications related to diabetes, insulin pump. So quite a lot of diabetes. And my main special interests are around getting the diagnosis of diabetes right in the beginning and getting the best care to our diabetic patients.
Great, thank you. Okay, so my first question, how common is diabetes in the UK in 2021?
I think it is a very important question, Caroline, because it's stipulated that 1 in 15 people in the UK have diabetes, and I think the total population diagnosed with diabetes is about 3.9 million. But the main problem is that quite a lot of people actually undiagnosed with diabetes, and it's estimated it's about 900,000 people. I think the main important message in that Diabetes Week is to promote the awareness of diabetes, and mainly to get the right treatment for diabetes, but also importantly get the patients diagnosed with diabetes, because the early diagnosis is actually key in making a difference to the patients.
Great. And most people know that diabetes is related to high blood sugar. Can you give more details about this condition?
Yeah, so the diabetes, it's a terminology we use, and the meaning of that is basically the people will have high blood glucose than what they should have otherwise. And as we know, the blood glucose itself is the fuel of the body. So we all need a certain amount of glucose. But in diabetic patients, their glucose levels are high, and they are not able to bring the blood glucose levels down. So once they have high blood glucose, they will start to get symptoms of diabetes. I think probably I can elaborate more on that. So when blood glucose goes high, what happens to them is that their thirst will increase, and they end up peeing a lot of urine in the night often. They can also lose weight, and they can also get more skin infections. And if they get wounded, it will take a long time for the wound to heal. So that's the kind of symptoms people get. But importantly, I need to also highlight that half of the people, when their blood glucose is not too bad or even high sometimes, they may not get any of these symptoms. And it is important for us to recognize that. And I think in this regard, I think the Awareness Week is mainly highlighting the fact that this undiagnosed diabetes patients need to have diabetes check done if they have any risk factors for diabetes.
Yeah, and what are the associated risks of having diabetes?
So often the diabetes itself is related to family history. So if somebody in the family has diabetes, there is a higher chance for other family members to get diabetes. The other risk factor is obesity. So I think, as we know, that the current trend of weight, is obesity levels are going up. Obesity, prevalence is going up in UK and all over the world. And with that, we are certainly seeing an increase in the number of diabetic patients. The other risk factor is that if they have other previous risk of gestational diabetes, for example, in women, and if they have also other associated conditions like hypertension or blood pressure, high blood pressure, or if they have other cholesterol problem, they are also more likely to get diabetes. So the risk factors are quite a few. And like I said earlier, if anybody has any risk factors, I think it's important for them to have, a check done, which is fairly standard and straightforward blood check for diabetes. One last thing I want to highlight is that, unfortunately, when we get old, our chances of getting diabetes goes up as well. And also, I think we also recognize that people come from BAME populations, so Black, African, Asian minority ethnic group populations are at higher risk of getting diabetes as well. So those are another cohort of people need to have blood check done for diabetes at the earliest opportunity.
Great, thank you. What is involved in diabetes treatment, ranging from well-managed diabetes to emergency situations?
Okay, so I think that's a very good question. So I think in regards to the management, where I get involved, I think my management strategy involve two ways of managing diabetic patients. Number one is to get the best level of their blood glucose control in the long run. And the number two is actually, as you say, avoid any complications and any acute emergencies related to diabetes. So if I start with the first one, the mainstay of the management for type 2 diabetes, which we are talking here mainly, is weight management. At the earliest opportunity, once people are diagnosed with diabetes, I think we need to have some support and clear advice about estimated weight loss or target weight loss our patients need to achieve. So that is important. And I have to say, I think quite a lot of patients nowadays are very, very weight conscious, and they do actually achieve that as far as they get the right advice from the healthcare professionals. The second thing is that it's important for us to control any other associated risk factors with the diabetes, like blood pressure control, smoking cessations, and even cholesterol management, because that is important, because not only the diabetes management is important for preventing heart problems, for example, but these additional risk factor management is important as well. If I move further to the diabetes treatment, I think the standard management is to start with tablets, and the commonest tablet being used for type 2 diabetes is metformin. So metformin, I think, is a very well tolerated, a very well recognized, and quite old drug in the diabetes field. And we start with a lower dose and then increase the dose to the maximum dose if required. The good news also that other than metformin, we also have a lot of other oral tablets we can use now to control diabetes. And we have drugs that works through the kidneys and get rid of the blood glucose through the kidneys. Seems to be very promising, and also promising to prevent any other complications related to diabetes in kidneys and heart problems, for example. We also have other tablets which works, with the meal time as well. So that's another tablet called gliptin, for example. And then other than the tablets, we also have insulin at times we will have to, give to our patients once we realize that, they will need insulin, they will need to be started on insulin. So that's how the long-term management of diabetes is done, really. And I think it's a very standard, and I think we're probably good at getting it right. But what we are not really good at getting it right is actually screening for complications long term related to diabetes. And as you already said about preventing complications and acute emergencies related to diabetes, I think there comes the importance of patients' educations about this, and telling the patients what to expect, when they get infection. And I think, as you would agree with me, with the COVID pandemic last year, I think there is a real need for us to educate our patients and, manage diabetes emergencies by themselves at times. I think, it's very well recognized, especially last year. So I think, in regards to the main emergencies, if I say a couple of emergencies, one is about high blood glucose emergencies. And, what that means is if the patient's blood glucose is high, they will need a treatment, and often sometimes they may end up coming to the hospital as well. And our main aim of managing diabetes is to try and prevent these hospital admissions. I think that's a long-term management.
Absolutely, thank you. Speaking about the coronavirus pandemic in regards to diabetes, What has been your experience of patients dealing with the pandemic and having diabetes at the same time?
It's been quite challenging actually for the patients and also for the healthcare professionals last year, the last 15 months now. With the COVID pandemic, increased the chances of, the diabetes increased the chances of people getting COVID infections. And it is thought to be about 2 to 3-fold increase in COVID infections if somebody has diabetes, especially the diabetic patients who has a high blood glucose levels are more risk of getting COVID infections. And on top of that, I think the studies have also proven that they will need more intensive treatment if they have COVID infections, if their diabetes control is poor. So that bring the recognition of controlling the diabetes, but the difficulty has been, as you would be aware, that most of the face-to-face appointments, most of the appointments have been quite tricky last year with the COVID infections, and the hospital has been busy with the COVID patients. So I think it really challenged some of our diabetes patients. And one of the other under-recognized problem with our diabetes patient is how the diabetes actually affect their mental health. And I will have to say that actually, that aspect actually has worsened much last year during the COVID pandemic, because, often, there has been a stretch in the support patients could get, but also I think generally, the whole population has been affected in many different ways with the COVID, including our diabetes patients. So I think it's been a challenging year for our diabetes patients, especially. So, what that means is I think we are probably going to see quite a lot of diabetes patients' blood glucose control going to be worsened over, the next few months' time. But not only that, I think, their mental health problems prevalence is likely to increase, because I think it's almost like a vicious cycle sometimes with the COVID, but also if the diabetes is worsened, certainly their mental health will be affected as well. So it's going to be, a big challenge for any, diabetes healthcare professionals in the near future.
Yes, absolutely. Speaking about how people's mental health has been affected, if diabetes management is overwhelming for people and even their family or carers, what support can they receive?
Yeah. So I think it's like I said, I think it's been quite, tricky last year. But having said that, I think it is very well recognized now that long-term conditions management is equally important to continue, even if it is a, COVID pandemic. I think that fact has been recognized. And in regards to the support available, I think most of them are through many charity organizations, including Diabetes UK. And I think NHS England also has, a certain technology support, and also certain virtual support available for anybody requiring any support, especially the family members you're talking about. And if I just highlight a couple of the high-risk people, maybe the people with diabetes and learning difficulties, people with diabetes and dementia, for example, I think that cohort of people, there are other charities supporting them as well. So but like you asked, and I think personally, there is still more to be done, and I think there is definitely a stretch in the system. Is probably my understanding of the issue.
Absolutely. And the final question: why is Diabetes Week so important?
I think I already tried to highlight a few things. I think the most important thing is to recognize diabetes as a disease and diagnose at the early opportunity in asymptomatic cases. And the main aim of doing that is to prevent any complications related to diabetes. One thing I didn't have a chance to tell so far is about the possible complications related to diabetes. And I think most of us are aware that it increases the heart attacks, risk of heart attacks. It increases the risk of stroke, and it increases the risk of blindness, kidney failure. So it's a long list of things. And the Diabetes Week is mainly to raise the awareness of the diabetes, in particular diagnose diabetes early and intervene them early with the view to prevent complications in the long run.
Fantastic. Thank you very much, Dr. Siva. And if you're interested, or if you have any queries about diabetes, you can find out more about Dr. Siva on his Top Doctors profile.
Thank you very much for the opportunity. Thank you very much. Have a good day.
Thank you. You too.
Bye-bye.